up of NABH, which is today very well recognized, like JCI, equally accredited by SCOA, and has actually helped us a lot particularly from the patients from the developed world who understand these standards and what accreditation is about. And I think now the second run, third run hospitals, now of course we have a national policy on this. So this is an important factor for a successful medical tourism, any hospital or who wants to. Finally, improving the customer experience, providing information, speed of response, quality of response, transparency. I mean, in my last job when I was working in a hospital, I used to do this little bit of, sending like a patient to hospitals in Thailand and Singapore and to India and try to find out how they respond. And I find these hospitals in these countries, they would respond within a matter of hours. Send us your medical reports, we'll arrange a con call with the doctor and specialist. And some of the Indian hospitals, including leading hospitals, won't even probably open their email for a week. So you lost that opportunity. If you don't have that speed of response, you don't have that quality, you don't build initial trust, obviously you've lost it. So improving this customer experience, the doctors always do a good job. And anyway, the patient is anesthetized and he doesn't know what's happening in the operation theater. But certainly, how he is treated, how he is received at the airport, how the nurses deal with him, how's the food, those are the things which probably make a bigger impact. So, and of course, there is a role of facilitators, international patient programs, because the hospitals are too busy with the medical work. Some of them have set up now international patient services departments and they're still struggling with it. But there are standalone companies which look at the entire process of pre and post care treatments, transfer of medical records, helping patients bridge that gap between, what to expect. Travel arrangements, even a concierge kind of a service, seamlessly from the point of arrival till going back. So, that's, I think, an important element in this. So, thank you very much. That was all I had to say, and I'll be glad to take any questions now. Yes, sir.
Good morning, sir.
Yes, sir.
Myself, Dr. Balakrishna, resident of orthopedic surgery. My question is, which are the medical specialties you think are proving to be key players in this sector, and which are the ones you will be thinking that will be competing with them in the near future?
Okay. Now, as a marketing person, what I understand is what is good for the consumer is really good for us. The point is, and this is I've learned the hard way really. There are some criteria you need to apply. The procedure should be the one where, number one, there is a wide difference in cost in his home country and this country. Number two, it should be a condition in which it is still safe to travel at least long distance to another country. He should not die on the way. And third is that after coming back, if it requires a minimal continuity of care, then that is the ideal kind of a procedure. Okay, so it's a win-win. Then it's a win-win for both. So I think orthopedics, spine, even cardiac. After bypass surgery, if everything goes well, though no infection, nothing, by and large, it keeps taking. He can continue. It doesn't require too much of, These are the things which are really, even bariatric surgery, which some of the hospitals, great centers of excellence who actually set up this, facility to offer continuity of care and all consultation on the phone, and so these are the things which really are more suitable for it. If somebody is in a 4th stage of cancer and he expects that he can come to India and get treatment and go back, and he should probably get treated by a local facility.
What do you think about neurosurgeons? Because in US the neurosurgeons have higher certifications compared to India. Neurosurgeons are
True.
Proving to be far better, actually. In Bangalore, sir, many procedures have been new procedures that...
Yeah, neurosurgery and orthopedics, I told you, these are the absolutely cut out for this medical tourism, no doubt about it. And now with a lot of new technology now, brain suite and robotics and, your outcomes are very much predictable and very successful.
Thank you.
Thank you.
So in the role of facilitator, why can't the foreign embassies be involved to give the much needed confidence which the patient when they want to come to our country for the treatment?
Foreign embassies are here for diplomatic relations and they're not really equipped for it, I don't know if you've been to any embassy from where these patients are coming in India. I mean, we tend to interact a lot with them sometimes when, there are transplant places and you have to get the documentation done through them. They're absolutely understaffed and they have no time really for all this. So I don't think so that they are in a position to do that.
Good morning, sir. My name is Dr. Aditya. I'm an Ayurveda practitioner from Goa. So what contributions can alternate sciences like Ayurveda and Yoga do in medical tourism? Because in Kerala and Goa, I guess.
Yeah. Actually, they are the front runners in this. And we have to actually learn a lot from them, how they have structured it. And particularly in terms of marketing, I think that's a much bigger game than tertiary care.
Well, how JCI is relevant now when NABH is already there, and why hospitals are spending so much on JCI? Is it worth paying back?
You see, things have changed now, no doubt about it, but when there was no system of accreditation here, JCI did play a very huge role. There's no doubt about it. I mean, Apollo Delhi was the first one to get. Vocard in Mumbai just got it just after a couple of months. I used to heading the international business. They had no international business at that time. And Vocard at that time had a collaboration with Harvard Medical International. So with our brand, we used to write Vocard, an associate of Harvard Medical International. With that, we said JCI and also tried to explain to them what JCI meant. And it did create a huge semblance of some trust for American patients. And we are actually able to build a lot of, So JCI, I agree with you. Functionally, NABH and JCI are almost at par. There is and probably NABH is much more relevant to the Indian context. But then probably for some hospitals it's an ego trip and they want that label. So there's no harm in it.
Good morning, sir.
Sure. Yeah. Please.
Myself, Dr. Vijay Goyal. I'm admin.
After this, I'll just take one last question. Fine, because my time is up. Yeah, please go ahead.
What are the legal liabilities on the part of health tourism consultant or consultancy in case if something goes wrong with the patient because of some unexpected complications or due to the negligence of the hospital or say some doctor?
No, see, the thing is like this. If the patient has come here in India, he signed all the forms, and accepted the terms, and the services delivered in India, the laws of India apply. And I think our laws and recourse are fairly robust now. As far as the medical facilitator is concerned, the medical tourism facilitator, I mean, usually our way of working is very clear. We just transparently tell the patient exactly what we hear from the hospital. And secondly, we really have no role in playing in delivering medicine to him, except the communication part of it, that too prior to his arrival in the hospital. So once he arrives in the hospital, it's entirely in the hospital's domain, So far we have not faced any issues with that. Also because we are very, very, clear about not managing the expectations and not really playing up the expectations so much. Take cases, work on cases where you feel you can actually deliver a lot of. Where the medical travel facilitator is adding value is if he's professional, he is actually exposed to many more cases and many more hospitals and the outcomes of many more hospitals over a period of time. So he can actually advise the patient more suitably. While a patient will directly write to a hospital, the hospital is going to give only that one view. So that's where they are adding a lot of value, but legally, as far as the outcome of the treatment is concerned, or because we have not delivered that, so there's no liability on that account. Just one last question, please.
Yes, sir. Myself, Dr. Rahul. As sir very well said about the highly skilled healthcare level education and training. So my question to you is, do we really have that manpower? Because I think that the top-notch, highly skilled doctors that we have are only a few in numbers. And by going to the statistics, we still lack like 10 lakh doctors right now in India. There is a deficiency of that. If you talk about the holistic medicine and all that in yoga and Ayurveda, I do agree that we have a lot of potential and we have foreign patients who are coming for that facility. But talking about the manpower, do you agree that we still have to go a lot in that sense?
See, this is a phenomena which is right now limited to top 10 gateway cities of India which have international connectivity. So specifically the hospitals, the tertiary care hospitals there, who are really, the top class, they are tapping this opportunity, and there is neither any waiting list there nor there is any dearth of good specialists over there. And every day I see new and new specialists returning from overseas with much better skills. So I don't see that. Now, how this phenomena travels to the second tier cities is something, but I don't really see that. At the macro level, yes, this country needs to invest much more in manpower and training and hospitals and medical schools, and which will happen over a period of time. So I thank you very much. Thanks for this patiently listening. It's been a great, wonderful experience. One great advantage of coming and talking here is it stimulates your thinking, lets you reflect, and also learn a lot. So I wish you all the best. Thank you.
Thank you, sir, for your enlightening insight into the field of medical tourism. I would request Dr. Samita Jadhav, ma'am, Deputy Director Academics, Symbiosis Institute of Health Sciences, to felicitate Mr. Pradeep Thukral.